Hello, my name is Michael Denoyer, and it is the 5th of September 2020. Here's my note card with my little notes on it for this brief discussion on the integumentary system. So the integumentary system um, basically protects the body from outside hazards and helps the body with thermal regulation. There's three main um, layers or structures when it comes to the integumentary system, which is the epidermis, the dermis, um, the subcutaneous layer or hypodermis, and then you have the accessory structures. So the epidermis consists of five layers, which is the stratum basal, um, which you have stem cells in here that help produce new skin cells. You have your melanocytes, which help with pigmentation and protection against UV light, and then you have your Merkel cells, which help with sensory receptors. Above that, you have your stratum spinosum, which have your Langerhans cells, and that helps with immune response. Then you have your stratus granulosum. Above that, in thick skin, you have your stratum lucidum, um, which only appears on the hands and the soles of the feet. And then above that, you have your stratum corneum, which is the outside layer, and again, new skin cells develop in the basal layer and then work their way up. And then as the skin cell dies, it gets pushed out and it kind of sloughs off on the outside of the skin. The outside of the skin also, this is where you're kind of, uh, well, you have different glands that are produced in the dermis, or that start in the dermis and excrete a film that help with um, water resistant and protection. So uh, underneath the epidermis, you have the dermis. There's two layers of the dermis: the papillary layer and the reticular layer. In the papillary layer, you have some nerve axons and some blood vessels, but the majority of the um, organelles and um, uh, structures are in the reticular layer. And that's where your blood vessels and they help with thermal regulation. You have your sensory receptors that help with touch and pain and pressure and whatnot. It's where your lipids, some of the lipids are stored. So that's kind of the dermis. Then you have the again subcutaneous layer or hypodermis, and this is mainly composed of adipose tissue. Then you have your accessory structures, which are your hair follicles, which protect the skull and help with sensory. You have your exocrine glands, um, which help excrete waste, as well as help provide a film over the body to help with um, protection and to become water resistant, um, and also help in thermal regulation. Then you have your nails, which help protect the fingertips and the toes. So that's kind of brief description of the integumentary system. Clinical application is I'd like to become a dermatological PA one day, and one of the things that they're kind of entrusted with treating or help managing is eczema. Unfortunately, there's no cure for eczema. You can only manage the symptoms. Eczema um, is a dermatitis that um, basically the skin isn't protecting itself against bacteria and irritants. So the skin becomes real itchy, can become gray or have grayish patches along the feet, hands, or the inside of joint spaces. And this can become, kind of really irritate the patient and can be scaly um, in appearance. So there are some creams out there, but mainly you got to figure out what the triggers are to try to reduce the triggers, moisturize the skin as best you can. Um, you can do some different types of baths and things like that. Again, just to help manage the symptoms there. So uh, that's the brief overview of the integumentary system in my video. Thank you.